Hi Savannah, how are you doing today?
Hi.
My name is Bill. I'll be your dental hygienist for today. I'm just going to go over your medical history real quick and your information. It says here you're in good health, and I see that you're under a care physician.
Yes.
May I ask you why you're seeing a physician?
I have diabetes type 2.
Okay. And are you taking any medications for your diabetes?
Yes, metformin, 850 milligrams.
Okay. How often do you take that?
Once a day in the morning.
Okay. So would you say your condition is, or your diabetes is controlled?
Oh, it is controlled, yes.
Okay. Did you take your medication this morning?
Yes, I did.
Did you have anything to eat?
I did. I took it at 7 a.m.
Okay. And did you also check your glucose level?
Yes, I did. It was normal.
Good.
It was 124.
Okay. Milligrams over a deciliter?
Yes.
Are you allergic to anything?
No, not that I know of.
Are you okay? Are you sure?
I think so.
Okay. No worries. Have you been to the hospital or anything within the past 5 years for any reason?
No.
Have you ever been to the hospital for your diabetes?
No.
Okay, Savannah, so we completed your assessment today, and our plan for today is we're going to do an SRP on your upper right quadrant, so that's a deep cleaning. Because of that, we're going to give you some local anesthesia there, so it's going to numb you a little bit, make it a little more comfortable for you.
Okay.
Just quick questions. Had you ever any anesthetic before up there, local anesthetic injections?
No.
Do you know if you're allergic to any kind of anesthesia?
No, I've never had this done. I haven't been to a dentist
Okay.
in like years. It's been like almost 7 years.
Oh wow, okay. So, well, just give us a second. I'm gonna grab the doctor. She's gonna give you an injection there, and then we'll go get started on your treatment. Okay.
Okay.
Hi, my name is Dr. Schuff. How are you?
I'm doing okay, just a little nervous.
Yeah, it's going to be okay. I'll be doing your injection today. Don't worry, it's not going to hurt. You're just going to feel a little pinch, and then you'll be comfortable for your entire procedure.
How long will I be numb for?
About an hour with this local anesthetic we're using.
Okay.
We're using Prilocaine 4% plain, and that's so that, without vasoconstrictor, it doesn't last quite as long, but that will be good for your glucose levels. Make sure it doesn't raise those.
How long is the needle?
It's not big. It's just not that big, but not very much goes in. Don't worry, it'll be okay. You won't even see the needle. I'll make sure.
Okay.
And it'll just be really quick, just a few seconds. We're also going to numb up the spot we're injecting, so you won't feel it go in or anything.
Okay. I trust you.
Yeah, it'll be okay. I just want to make sure one more time. Have you ever had this before, local anesthetic?
I haven't been to a dentist in like 7 years.
Okay.
So I haven't had local anesthetic.
Okay, so you've never had a bad reaction to anything like that?
No.
All right, just double checking. So we're gonna lay you back.
Okay. Oh my
I'm
gosh.
just gonna wash up and get my gloves on, and we'll get going.
The injections we're doing today to do SRP on the whole upper right quadrant as a treatment are the posterior superior alveolar nerve block, the mid superior alveolar nerve block, and the anterior superior alveolar nerve block. You saw Dr. Schoaf demonstrate the ASA one, and we're going to demonstrate the PSA and MSA. Also, we chose Prilocaine because our patient has Prilocaine 4% plain because our patient has controlled diabetes. So we wanted to limit the amount of epinephrine. So as a dentist, we just decided to do 4% Prilocaine plain. Okay, so for the injection technique, so for the PSA injection, our injection site is going to be at the height of the mucobuccal fold, just distal to the second molar. And we will inject 1.3 milliliters of solution over 30 to 60 seconds. So for the MSA injection, I'm going to inject towards the apex of the second premolar, 0.45 milliliters of solution. And then for the ASA injection, I'm going to inject towards the apex of the canine, and it's going to be 0.9 to 1.2 milliliters of solution. Okay, just wanting to check on how you're feeling. It's been about 5 minutes. Are you feeling okay?
No, I feel a little burning and tingling and pain right here.
Oh, you
Like
do?
little needles. It feels like little needles or something.
Oh, it sounds like you're having a bit of paresthesia, and it's nothing to worry about. It can... But don't worry, your nerve will heal, and it's just a little trauma to the nerve. So
Okay.
it'll heal. You might just have that, little symptoms from that for the next 8 weeks, but you'll be okay. Don't worry. Okay?
Okay, I'm kind of scared. I don't know if I want to do this today.
Oh, okay, so we're actually going to go ahead and send you home today, and we'll bring you back on another day when you're feeling a little bit better, okay?
Okay, thank you so much.
All right, absolutely. You take care. Call us if you have any reactions to anything or if you're not feeling okay, okay?
Okay, I will. Thank you.
Hi, are you okay? You're back already?
No, I was here earlier, but now I'm starting to turn blue, and
Oh, you
I'm
are
shortness of
very
breath,
blue.
and I don't know if it has anything to do with anything earlier we did. I don't know what to do.
Oh no, why don't you have a seat?
Okay.
Yeah, you don't look too good.
No, yeah, I don't feel too good.
Is your head okay?
No, I feel lightheaded. What should I do?
Okay, so what our patient is experiencing is a condition called methemoglobinemia. And basically, what that is, that causes symptoms of cyanosis, which means blue skin. So their skin will get really blue. They'll start getting giddy and loopy, have a headache. They'll get an altered mental state, feel fatigue, shortness of breath, also lack of energy. And then if it progresses, and isn't treated or stopped or go away on its own, then that can progress to syncope, shock, seizures, and even death.
It's a condition caused by an excess amount of methemoglobin in the blood. This can be induced by orthotulidin, which is actually a primary metabolite of prilocaine, which is the injection we use on our patient. Basically, it causes the lack of oxygen in the blood, which causes the skin to turn bluish to grayish. This administration of a large amount of prilocaine to a patient that is susceptible to this condition, hereditary, can cause a reaction.
So methemoglobinemia typically has a reaction that occurs 3 to 4 hours later. Symptoms typically last from 12 to 14 hours. However, in emergency cases, it can be treated with supplemental oxygen and methylene blue 1% solution by IV slowly over 5 minutes, and it can be repeated every 4 hours as needed. Usually these symptoms go away on their own, but in severe cases, medical attention is required.
Methemoglobinemia can be either drug-induced or hereditary. In our case, it was hereditary and drug-induced. Normally, the MRD for prilocaine, it's known that it can cause this, so the MRD keeps you well below the level that would cause a methemoglobinemia reaction. But if you have a hereditary tendency towards it or a family history of it, small amounts of prilocaine can induce this reaction, and that is what happened to our patient.
So based on our patient's case, our patient didn't disclose to us and our professionals and our dentist that they've had family history associated with methemoglobinemia, with association with prilocaine and benzocaine. So this is why it's imperative to ask your patients open-ended questions